Welcome back to Juices the New Tea. I am your host, Eleni Simos, also known as the Clean Eating Chick. And today's episode I'm really excited about because we have a specialist on to talk about sexual health and wellness. We have Jacklyn joined with us today on Juices the New Tea to talk about our bodies, how to reconnect to our bodies, sexual health, empowerment, feminine essence. And she brought some props for us today, too, to keep it very educational and to show us what it is that we're going to be talking about. So, Jacklyn, welcome to Juices the New Tea.
Thank you, and thank you for having me. I'm so excited. Yes. Obviously, I love this topic, so I'm so excited.
Absolutely. I'm super excited to dive right into it. I want to start with a little foundational educational conversation, right? So, what exactly is the pelvic floor, and why should we care about it?
Okay, so the pelvic floor essentially is a collection of muscles, connective tissue, ligaments at the base of the pelvis. So it's right there. And they connect from the pubic, so which is the front, to the tailbone, so all the way to the back and the sides. However, we can't look at the pelvic floor as just the floor of the pelvis because it doesn't work in isolation.
Right.
So it works with other things. So your diaphragm is involved, which is the muscle that's right under your rib cage. And then you have your transverse abdominals, which is your deep core muscles. So we hear that a lot, like engage your deep core. And then we have your deep back muscles.
Right.
So you're going to think about it like a house. So you have your roof, your pelvic floor, your sides, and then that is your pelvic floor system.
Cool. What made you want to get into this work? So you are a pelvic floor therapist and sex and intimacy therapist?
Yeah. So by profession, I'm an occupational therapist, and then I specialize in pelvic health and sexual health. Amazing. So throughout my OT career, I didn't feel like I fit in. I was like, I worked in pediatrics, I worked in a hospital, I worked in a subacute facility, and I'm just like, I don't know. I just
Where's my niche?
Yeah, I don't fit in. I have a heavy fitness background. And then I went through my own pregnancy, and it was pretty much an uneventful pregnancy, but I had severe sciatic pain. So like I couldn't walk from here to like you without excruciating pain. And then the answer that I got from the doctor was like, you're pregnant. Like, you know.
Was this for the duration of your pregnancy?
The whole pregnancy.
No. Oh my gosh.
Yeah, so like excruciating pain. And I was working in a hospital, so I was on my feet for like, 12 hours.
Yeah.
And then after I had my second child, I had hormonal dysfunction. So, and again, the doctor was like, well, you're postpartum. So I'm like, there has to be a better way. And then that's when I kind of just like, I'm an occupational therapist, health and wellness, women's health, like where do I belong? And then I found it and I never looked back.
Yeah. I can see the way when you talk about it, you just light up. Like you do love to talk about it.
I do. And my patients literally drive me.
Yeah. Good. Well, that's intentional work, right? That's what you want to be doing. So the pelvic floor, the deep core, all of that, we hear that all the time to engage those muscles. But what are some of the common signs that someone's pelvic floor isn't functioning optimally?
Yes. So we have urinary leaking, urgency, frequency, painful sex. We have constipation because it's not only the front side. You got to think of it as the back side also. We have hip pain, groin pain, tailbone pain. Yeah, so many things. And if you're looking at it from a male perspective, also erectile dysfunction, and then all the other things that I just mentioned.
All of those symptoms are normalized, right?
Oh, yeah.
Yeah. So let's talk a little bit about like why and how they're actually not normal. And just like, I think also too, just bringing it back into like Western medicine and just how we don't approach things going to the root of the cause of a side effect or a symptom. We just kind of put a blanket over these things and just chalk it up to being like, well, you're pregnant or you just had a baby or postpartum or, that's normal, but it's not.
Yeah, and it's so normalized. And we go through all of these stages throughout our lifetime, right? We have pre-pregnancy, we have pregnancy, we have postpartum, perimenopause, menopause. And like we just keep going through all these transitions, and we'll go to the doctor and everybody's like, well, you just had a baby, you know, if you're leaking. Well, you just had a baby, give it some time. And then you're like, okay, well.
But they don't offer any exercises or any insight or any just anything to do to strengthen.
Well, the rule of thumb is usually do Kegels.
Yeah.
You know, do your Kegels at the stop sign and do your Kegels. However.
Not at the stop sign.
However, providers are not rehab specialists, right? Yeah. So it's kind of ill-advised to just say, like, do Kegels.
And there's also just so much like taboo and shame around the conversation too. And just like people don't want to highlight these parts of their bodies or like talk about them. So that's why I'm just like so excited to dive a little bit more into this. So in terms of, I mean, the Kegels, I was going to wait and save that for a little bit, but I want to talk about the importance of doing your Kegel exercises, but also, and I actually, we've never talked about this, so part of the reason why I like having conversations with you too is because you do have some different viewpoints than me, and like I always learn, or, you know, we kind of just like bounce back and forth with this a little bit. In terms of the Kegels, we all hear that as women. I think men too now are like learning to, I don't know anything about that, but we hear about like, do your Kegels at the stop sign, squeeze, hold, all of that. Yeah. But Dr. Andrew Kegel, he was the one who started talking about the Kegel exercise. But the thing about it was that it's basically pointless if there's no apparatus or there's nothing to give you that resistance for you to squeeze your pelvic floor muscle or your Kegel muscle against something. True or false? What are your thoughts on that?
I'm not like pro Kegel in terms of an exercise because essentially what it is just an isolated contraction, right? You're taught to lift your pelvic floor, right? That's a Kegel, lift your pelvic floor. Most of the time, people are so disconnected to that area of their body. Right. They have no idea what lifting the pelvic floor means. They're squeezing their butt, they're sucking in their belly. So when it comes to do a Kegel, it's one, are you doing it correctly? And two, is it functional? Because I'm sitting here doing a Kegel right now, but then when I go...
Are you right now in this moment?
Yeah, right this second.
Okay, sister, I can see you gotta like the glow in your face.
But then it's just like when I have to go lift a weight, how is that translating over?
Right, because one of the women that I love listening to, Kim Anami, I don't know if you're familiar with her at all.
No.
She talks, I mean, she's a big proponent of the jade egg, the yoni egg. Okay. And she would always say, like, if you go to the gym and you just, you know, lift your bicep, you do a bicep curl, but you don't have any weight, you're not building any muscle if there's no resistance. So that's why she's a proponent of doing your Kegels or like strengthening your pelvic floor with the jade egg. But she does encourage people to connect to that part of their body first through meditation, through breath work. Because I agree with you. If you just turn around and you tell somebody, you're on Instagram, you're scrolling, there's a woman that I see, and she's like, all right, girls, hold, squeeze, breathe. And it's like, I wonder how many people are actually like knowing what they're actually supposed to be squeezing.
I don't know. I use it as a form of feedback. Like, let's get intentional with our body. Let's tune into the space. Do you even know what it's supposed to feel like? Do you know what a Kegel, I'm going to say like 85% of my patients, they're not tuning into that body area, and they're not doing it correctly. They're like sucking in their belly. I see a lot of glute squeezing. So then to go automatically to a Kegel, it's not the best.
Right.
So I say, let's start with it from a feedback perspective. Let's tune into that space. Let's see what it feels like. But then I'm going to go to exercise because that's where the true magic happens.
Right.
And in terms of the pelvic floor, it just doesn't work as a isolated system. It works with everything else, like the rib cage, the feet, the tongue, the mouth, like all of it.
So the way that I was taught was that it's the muscle that you're supposed to hold, like while you're peeing. Chris, I love you so much. Thank you for being here. I'm having this very raw conversation in front of my male producer. But you know what? Let's smash the glass wall, bro. Like, let's talk about it. Let's get him in on it.
Keep going.
But I was told, we're getting really close right now. I was told that it's the muscle that while you're peeing, if you stop peeing, that's like your Kegel. I didn't like explain that properly. But while you're peeing midstream, you're supposed to hold and like pause, and that's your Kegel.
That would be a cue to use if it's a Kegel, yeah.
Okay.
But then you also have to think that there's multiple layers of the pelvic floor. So there's a lot of rolls. And we don't think about pelvic floor rolls as it's involuntary, right? So you're not thinking about what is my pelvic floor doing right now?
I mean, I think about my pelvic floor often.
Well,
I do.
Did you, like, years ago when you really didn't know
years
about
ago,
it?
no. When I was like becoming a woman, 14, 15, 16, no one talked about anything like that.
Which we should.
Yeah,
we
absolutely.
Should.
It was
We
more
should.
so, I want to say, like, maybe 8 years ago that I was like, oh, okay. And then the more that I started training and just like, you know, opening up my mind and my awareness to different things, I'm like, okay, interesting.
Yeah.
I
So
like
we're not
that.
supposed to think about it.
Yeah.
You're just supposed to, it's supposed to do what it's supposed to do. So it has multiple roles to
Right.
keep pee and poop in.
Right.
And to let it out when it has to.
Right.
Sexual function. So erection, blood circulation, orgasm, support for your organs. So being able to hold them,
right.
because then the opposite would be prolapse.
Right.
Allowing for blood flow and circulation, so sub pump, and stabilization, so stabilizing everything that's kind of where your core is.
For those that might not know, what is prolapse?
So prolapse, because
You can,
I'm gonna grab it.
yeah, you can grab our, do we have a name for our pelvic floor diaphragm guy?
Don't.
No, we should name him or her.
Just my friend. My kids use like the organs as like accessories. Yeah,
Good for
they
them.
blow it in it like a trumpet. You know. So for females, you have your uterus and your vagina. So that's sitting inside your pelvic bowl. So it's a bowl.
Yeah.
It's a hammock, right? And then here are all these muscles. So your bladder's in here, your vagina and your uterus and your ovaries. And then you have, let me reach. You have your rectum that's in here. And then you have your external pelvic floor muscles, which is your external vulva, your vaginal opening, your clitoris, your urethra. So in terms of what prolapse is, these contents could drop down because connective tissue gets loose and lax, and then you have organ prolapse, whether it is your bladder, your uterine prolapse, or your rectum.
So you can prevent prolapse by engaging with your pelvic floor, doing Kegel exercises, and I know a lot of people like would resort to surgery. What are your thoughts on that? Like, do you think that you could reverse prolapse, prevent prolapse?
I think you could definitely take action to prevent it. And it's not just from a muscular standpoint, it's a pressure standpoint also.
Yeah.
Because our abdomen is a pressure system. So the more pressure that we have, if we're not managing it correctly or optimally, everything's going to be shooting down. So that's why I say we have to look at other points too. We have to look at pressure going up, pressure going out to the side. Think of our body like a balloon. Instead of just breathing into our chest, breathing into our belly, we have to look at the sides and the back also. We don't typically think about breathing into our back body, but like sitting in like child's pose, like a little hunched over and trying to expand our back, that's really important.
I love that. Can you have a weak pelvic floor and an overactive one?
So, a tight and overactive pelvic floor is a weak pelvic floor. Yeah. So, if our muscles are always contracted, right? They're always guarded, they're always shortened, it doesn't generate optimal force. So, muscles have to work from a full relaxation and a full contraction. So overly tight muscles, as they are continued to be tight for a long period of time, they are going to be weak.
Okay. And now kind of shifting to, we talk a lot about the nervous system on this show and emotional connection to the different parts of our body, right? On a physical, mental, and spiritual approach. So do you think that the pelvic floor holds trauma?
Yeah, and I'm a big nervous system gal.
Okay, yeah. Well, welcome. You're on the right show.
Yeah. And I think our body as a whole holds trauma, right?
Yes.
And it just depends on where specifically your body holds experiences. That's kind of, I feel, individualized. And a lot of people that I've experienced with, a lot of trauma is held in their pelvic floor because you don't see it.
Yeah.
Right? So some people...
There's such a disassociation.
Yes. Yeah.
So like, again, it's going back to just like the conversation, the topic, that area, engaging with it is so taboo that people just like shy away from it instead. And like that lack of acknowledgement too of a part of your body, that's also like trauma that you're inflicting on yourself, just even like unknowingly.
Yeah, and you don't see it. And, you know, if you're sitting there and you're like hunched with your shoulders to your ear, you're consciously like, oh, what am I doing? Right.
Yeah.
And then you could relax and you could kind of like move your shoulders, but you don't really see what your pelvic floor is doing. I know that just as like a generation, we kind of tend to just suck in our bellies. Like, we have
or
to
like
suck
the anterior
in.
tilt, like, you know, sticking your ass out and like walking around like that and not like,
So I think that subconsciously we hold our bodies a specific way. And it's not like we're going to sit there and be like, oh, I have to relax my pelvic floor. That's something I teach. But we typically don't do it.
How does that tension then manifest in the body or like in the pelvic floor, in all of the muscles that are in that area, like holding on to that tension? How could that manifest physically?
Yeah. So just like your pelvic floor muscles are skeletal muscles. So they're just like your biceps, your quads, they're just like any other muscle. So if you're constantly holding or gripping your pelvic floor, let's say like leaking, for example. So if you're constantly holding in your pelvic floor muscles and then you have to pee and they're just been gripping, holding constantly and they're asked to hold pee, they're not going to be able to. So then there's just going to be leaking. So also, if you've had past experience of trauma or negative experiences with sexual intercourse, then that could manifest in pain with sex and just any pain with any intimate experience, which is not cool also.
For sure. What's the connection rather between, you touched on this a little bit, but more so the pelvic floor and the nervous system?
So if you look at it like our nervous system is our alarm system, our command center, our communication center, and there's two ways, right? Fight or flight or rest and restore. So if we're constantly in this fight or flight, this go, 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 you're stuck in traffic, you're arguing with somebody, you're in this tension state. So you can't pick and choose what muscles want to be tight or tense. It's just kind of like an overall body experience. So if we don't kind of tap into them to be able to calm and go the other way, so rest and digest and restore, then they're going to go into that chronic tension state, which then goes and repeats that cycle.
Right. How would chronic stress then affect the pelvic floor?
So if it's chronic tension and then symptoms. And then you go to the doctor and they're normalized.
And you put on the hamster wheel of like, your body is doing something to you and you don't know what it is. And it's like a medication or it's this or it's that.
Yeah, or give it time, have a glass of wine, try to relax. I have heard some crazy stuff.
Yeah, I'm sure. So let's discuss, this is like a topic that I like to live my life by. The idea, people make fun of me for this, but the idea of being turned on by your life. Like I feel like men and women, especially women, we are like the creators, right? We are the expanders of the vision that the men hold, right? So for me, there's something that I like to live my life by being turned on by my life, by enjoying my life, right? So let's talk a little bit about like the feminine essence of just like connecting to this part of your body and even like allowing for that connection. Once you strengthen that connection, right, and you become aware of that connection to your body, like leading your life through that or like listening to that part of your body. Because I'm very much like building the awareness, strengthening your intuition with your body, allowing your body to speak to you, giving the space for you to be able to do that. And I feel like that's, you know, in tune with you, with obviously the work that you do, encouraging your female clients especially to like maybe like live their lives more sensually or allowing for them to eliminate the fight or flight and get into that rest and restore, that rest and receive that you talked about. So almost like allowing for that idea of like a turn on to direct your life's choices or like your life energy. Do you have any thoughts about that?
I think of it from a perspective of really tuning into yourself and being a little selfish in a way. So when it comes to like pelvic health, a lot of people are so disconnected to their body. So then when it comes to, let's say, intimacy, right? You think of it, or we're meant to think of it for the other person. But it's really about you and how you feel and what turns you on. And this kind of goes into what you were saying, like being turned on by life. It's kind of like living for you, and then that is going to be portrayed out.
Yeah. Juice is the New Tea is brought to you by Cleanse Juices. For more information on 3-day juice cleanses and 4 flavor packs, visit iamcleanse.com. Use code Juice is the New Tea for 10% off all orders. Well, I feel like if you are genuinely excited by the things that you're doing and the work that you're doing, like that energy, that frequency omits in every single area of your life. Like if you're doing work that you don't like to do, that's going to show in your face. That's going to show in your body language. That's going to show in how the energy that you unintentionally exude off of your body. But if you're like doing work that keeps you in your purpose, that's exciting for you, that like lights you up. I mean, I said it before, like you light up when you talk about this. I know when I'm doing the show, like I light up. This is something that I genuinely love to do and it shows. So I feel like that's just such an important way for people, especially women, because there's such like an interesting, polarity or like a reversal of roles that I think a lot of people are talking about now between like the feminine and the masculine and like glorifying, girl boss energy. And like, there's a space for that 100%. But I also think like, no, let men be men, right? And like, let's uplift the men in our lives, but also like as a woman, like allowing for yourself to rest, to receive, to romanticize your life a little bit, and like also just stay connected to what it is that makes you like a feminine goddess. You know what I mean?
And I think also that like feminine and masculine energy is sometimes thought of as gender roles. However, like I lived in a masculine I've lived in masculine energy so much that it's exhausting sometimes. And I'm like, as I get older, I'm like,
you deplete your energy.
I'm like, I really need to just tune into my feminine energy, which I've been trying. And I think I'm doing a good job at trying.
I think the awareness is half the battle. Because I feel you, sis. Like when you're building and you're like a driven female, sometimes it's hard to find that balance and to like harmonize that energy. But yes, we all have both feminine and masculine energy within us. It's just about like knowing that you need to balance that, knowing when to embody one versus the other, and just giving yourself that space.
Yes, I love it.
Yes. So just, like kind of talking about engaging your pelvic floor. So like one of the first things that you said, like we're told when we're training to engage your pelvic, to engage your core, right? What does that mean? And maybe we can just like talk through for people that are listening exactly how to engage their pelvic floor, whether it's like right now in the moment, if they're at a stop sign listening, or if they're training, like how exactly for people to do that.
I would say first things first is breathing. That's like hands down, like put the Kegel aside and tap into diaphragmatic breathing because your diaphragm and your pelvic floor are moving together. They're like, think of a jellyfish. Like when it swims, like it's like going up and then propelling itself. It's very beautiful. And that's what our diaphragm is doing with our pelvic floor. So as you take a nice big inhale, and I'm not talking like take an inhale.
Not a chest inhale.
Like this. That's like fight or flight,
belly breath.
Right? So it's more diaphragmatic. So you want to think about rib cage expanding outwards, not even belly breath, because you don't want to put too much pressure through the belly. So you want to think about your body as a balloon. So I sometimes say, like, think about expanding your bra strap out to the side. And then your pelvic floor is going to connect with your diaphragm, and then it's going to lengthen and move down. And as you exhale, your pelvic floor is going to lift and come back up and your transverse abdominals, your deep core is going to engage also. So stemming from the breath is really key.
Yeah. Okay, I love that.
Yeah, I love it.
What workouts can support or strengthen the pelvic floor?
Resistance training all the way. Like, pick up some weights. It doesn't even have to, like, start with no weights.
Yeah.
Right? And do some squats, air squats, body weight squats, and then gradually go from there. But squats, glute bridges, hip thrusts, lunges, those are all great exercises.
And doing those exercises while also focusing on that diaphragmatic breath that you were talking about.
Like, don't even focus on what your pelvic floor is doing.
Focus on your breath.
Focus on your breath.
Yeah.
Yeah.
So what exactly is your perspective or your position on the jade egg? Because I still feel like you're not into it. You're not into it.
It's not that I'm not into it, right? It's not that
I love my jade egg.
And I will never, ever knock anybody from doing anything that brings them joy, right? So if it brings you joy,
yeah, it does.
Go for it, girl.
Okay, thank you.
But as part of a evidence-based practitioner,
okay, talk to us on the evidence-based.
I'm just going to say there isn't evidence to support what it's telling you that it's doing, right?
Okay.
So if you love it, go for it.
QG Flora is a luxury florist in New York with over 50 years of experience. They even provided us a special discount code you can use, the code CLEANBLOOM, for 10% off website orders over $125. So gift yourselves or your loved ones a beautiful arrangement.
And let's talk about the fact that women weren't even allowed in clinical studies until 1993.
Which is insane.
1993? 1993.
What?
Yeah. So there's going to be limited research in women's health, sexual health.
So is it possible that there just hasn't been enough
It's
studies
alternative.
yet?
It's alternative medicine. So maybe they're just,
all right, Chris, earmuffs. But I would use my jade egg and there's a string, like I would tie a string through it because I like that one, and would add weight to it and like work out or like be at home, do some squats with weight in the jade, like hanging from the jade egg.
Yeah. So there are like Kegel.
I'm really getting really close with everybody right now. This is like very,
and you know what?
And there's no wine, there's no alcohol. This is purely sober.
And everyone's like, TMI. I was like, nothing is TMI. TMI to me,
but I'm sharing this with, it's not just me and you and Chris having this convo. There's a lot of people listening to this being like, Eleni's at home with a jade egg doing squats, holding,
Yeah.
Because Kim Inami, not to bring it back to her, but she can lift like papayas and chandeliers and surfboards with her pelvic floor.
Good for her. Good for her.
Do you think that there's like any, like, I mean, okay, I'll save that for another time.
Yeah, and I'm not against it, right?
Yeah.
One, I just have to look at like the jade egg. What kind of material? Is it medical grade? Obviously, you're thinking
I'm using
about
like a jade, like a crystal.
Yeah, so you're thinking about like anything's inserted into that area.
I honestly,
your string, make sure you have it. You gotta take
it's
it
organic.
Out.
It's cotton. I'm very particular about the materials that I put on my body and everything.
And inside,
and inside for sure. I wouldn't even like be using plastic or like silicone base for a really long time. It was just crystals for me. That's how I roll.
And people use it for different experiences, right? They say sometimes they connect a little bit more sensually with themselves when they use it. So I'm not against it.
I also like with crystals specifically, with just some of like the healing properties and components of working with the crystal energy, with jade being like a very beautiful, like grounding, feminine energy. And then I have a black obsidian, which is just like to release trauma and just like all of that. So there's intention behind, you know.
And I love that for you. I do.
Thank you.
Yeah. And that's why I will never, ever knock somebody's personal human experience.
Yeah.
Like, I will educate them, obviously.
Yeah.
Like,
No, educate me. I want to learn
like,
more.
Lack of clinical studies, you know, that's what I would say. But if it works for you, it works for you. And who am I to say that, you know, don't do that because it doesn't have clinical studies. Like, you know.
No, but I totally like respect and appreciate your perspective too, because I think sometimes I don't always incorporate a little bit more of like the scientific approach because I am very much, you know, like I hate saying woo-woo, but that's just, it's kind of like in my head that I'm just like, you know, everything is energy for me and intention-based, but there's like a mysticism that I like to just incorporate. But I do sometimes think that my balance of like my yin and my yang is I have to do some more clinical research on certain things that I do, just, because things that I talk about is not always for like everybody too, right? Like you have to find what works best for you.
100%.
What feels like most empowering for you.
Yeah. And I I float between the two.
Yeah. Yeah.
So kind of that's where.
Well, you're my grounding force right now. Okay. So thank you. At what point should somebody seek pelvic floor therapy?
I mean, I would say before anything,
even if there isn't an issue, isn't it still beneficial?
Yes, because we're so disconnected to our bodies.
Yeah.
And we're getting further and further away from them. If you're looking,
so?
Yes, and it's sad. Look at if you're looking at Oura rings and all these devices, they're great. They give you data.
Yeah, they give you insight.
But we're getting so far away from trusting our own body, like hunger cues and sleep and recovery. Like, why can't we just sit there and like tune into ourselves and kind of see like, what does my body need? My body says I need rest.
Well, we're all overly stimulated.
So stimulated.
Yeah.
So
people just also can't be bored.
Yes.
People can't allow themselves like nothing.
I know.
And
boredom is
me too.
Okay. I mean, that's me too.
Yeah. But you have to have the balance.
Yes.
Right?
Yes.
All right. So let's talk a little bit about intimacy and confidence. So how can strengthening or relaxing your pelvic floor impact sensation?
Good question.
Thanks.
So part of an orgasm is the relaxation and contraction of the pelvic floor muscles, right?
Yes.
So if you're thinking of them as too tense or too weak, then that orgasm may not be the orgasm you're looking for.
Not that earth-shattering.
Yeah. Or some people, they cannot achieve one.
Yeah.
Or sometimes people have painful orgasms. So I think it goes back to these muscles need to be working in their most optimal way, which is full length and full contraction.
Interesting. Let's talk a little bit about like the importance of warming up the body or warming up the pelvic floor muscles through communication, through connection, whether that's with yourself, with your partner. So let's talk a little bit about that. Any thoughts or like practices that you can share?
Yeah. I would say it is tuning into your own body first. This is like kind of what I was saying before. I always do mirror work with people or introduce or talk to them about doing mirror work. Like, have you looked at your vulva in the mirror?
Yeah.
Do you know what it looks like? Do you know the parts of it? Even for men, I speak on this as well. Sometimes if people have a little bit of low body awareness or self-esteem, I'll say like maybe go from your bedroom if you have the opportunity from your bedroom to the bathroom naked and see what it feels like to be naked, touching yourself, touching your inner thighs, touching your vulva, kind of just tuning into yourself and really connecting with yourself is important.
Yeah. How does pelvic floor dysfunction impact intimacy?
So pain with sex, which is heavily normalized.
Yeah. So what could contribute to somebody having pain during sex? There's a couple different, it could be emotional.
Yes.
Right? It could be like a lack of like distrust with your partner, with yourself.
It could have
the body could just not be warmed up enough.
So I think that there's multiple factors. One, it could be a past experience that was very negative, past traumatic experiences that are unrelated to sex and intimacy. There's conditions called vaginismus and vulvodynia. Those are pain conditions. So vaginismus is the involuntary contraction of pelvic floor muscles when anything tries to enter the vaginal canal. So people kind of say that it's like burning, stinging, like it's a block, like nothing's going in.
And that's not like somebody's not intentionally doing that. That's just the body reacting.
Yeah.
Interesting.
And then vulvodynia is just, it doesn't have to be that something's entering. It's just a pain condition that lasts for like 3 months or more. And it could be with stimulation, without stimulation. And then pain with orgasms.
Pain with orgasms? I've never heard of that.
Yeah.
Interesting.
If somebody achieves an orgasm, they could feel like severe pain after, during, continuing.
What are some of the ways that you would, or like practices that you would have your clients implement if they were experiencing things like that?
It's very individualized and kind of where it's stemming from. So a lot of it is nervous system work, and understanding that the body needs to feel safe, and then doing the physical part, which is with the muscle itself, some dilator work. So using a dilator and then going up in dilator size, but your body has to feel safe first in order for you to kind of do the dilator work, I find.
Yeah. Well, I feel like the safety can't come before that. Yeah, no, for sure. All right. Well, let's talk a little bit about womb health as a whole. And maybe you can shed a little bit of your clinical study energy. Because the womb to me is more than just like a physical organ. So much of my body and my approach and everything is energy. And it's, seen as an energetic center of creation, intuition, and emotional memory. It holds not only the potential for life, but also our ability to create, feel, receive, and transform. So I like to talk a little bit about connecting women, like connecting with their womb and certain practices that they can do to connect to that space. There's like some really beautiful like womb meditations that I like, if you can recommend.
I do them.
Yeah, beautiful. Any of those that you incorporate for yourself or with your clients. And then also, I haven't talked to you about this yet, but yoni steaming. What are your thoughts on yoni steaming? Oh no, do you not like that either?
It's okay. It's not that I don't, again.
Okay, wait, let's talk about what yoni steaming is. Okay, reel it in. So yoni steaming, I do this like at least once a week. It's the practice of specific herbs. I make a blend myself. I do rosemary, raspberry, calendula, lavender, rose petal, yarrow root, and I think that is it. I make the blend, I steam it, I boil it in water, filtered water, and then you bring it to a boil. The herbs, there's obviously like a practice and a little ritual and meditation that I like to do, like thanking the herbs. I have like really good vibing music on, just kind of like set the tone, set the space for yourself. And then the idea of it is that you like sit over the pot and you steam. You steam your most beautiful feminine parts, your yoni, everything. And ideally wanting to keep yourself a safe distance from the steam. Yeah. I find for me, it's, again, like, I guess if you would say it brings me joy, then keep doing it. But I feel like not only just like emotionally brings me joy, I feel like there is something to be said about just like from an energetic standpoint, I like to do that after my period or after I have sex with somebody, like just like to cleanse and clear the space of just like, because sex is an energy exchange, 100%, right? Yeah. So I like to just do that almost as like a little practice for myself. And I find that it like increases circulation. It does like make me just feel aware of that part of my body and like grateful for that part of my body. And I, have worked with people or have heard from other women that have done that and have been able to reverse certain things that they were experiencing, whether it was like from a trauma perspective, being able to release tension, if there was like a hormonal imbalance, if they were suffering from like chronic BV or anything along those lines, and they would practice yoni steaming, like it would help. So I don't know. I mean, that's kind of my experience with it and my knowledge and my appreciation for that type of work. So curious and interested to hear. I already can tell from that smile.
No, it's once again, it's your self-care, right? And it makes you feel connected to yourself and it makes you feel good from an energetic standpoint. Those are all amazing things. Coming from a scientific standpoint, our vagina is a self-cleaning oven, basically, right? So we don't need to do all these things from a scientific standpoint. And from the vagina and the vulva, the tissue is very, very delicate and thin. So if you do it, or if somebody's never done it before and they want to try it, you just got to make sure that steam is not too hot because the risk of burns is very high.
And also not doing it
right?
if you're pregnant.
Yeah. So
not doing it on your period.
Exactly. Yeah.
Being intentional of when you are doing it.
Yeah.
For
so
sure.
I would definitely consult with somebody.
I think the thing, and I hear that and I respect that point of view, but I think for a lot of people, especially girlfriends of mine that I know or people like that would message me on Instagram, they're inserting things or they're taking antibiotics or all of these things.
Yeah.
So I hear you in terms of the vagina being self-cleaning, but I think like we're just an overly consuming or something like type of society where we think that we have to take and do.
I agree. Yeah.
So there's something to be said about just like, these are herbs. This isn't something man-made in a lab.
Yeah.
This is something that you get to facilitate and do for yourself if you feel comfortable in the safety of your own home. Like there's just something to that effect that I think is empowering.
100%. Yeah.
Yeah, that like if maybe somebody doesn't necessarily feel comfortable with mirror work or like mirror play, anything like that, like this is something that could still bring awareness to the area without maybe just like stepping too outside of the comfort zone.
Yeah.
I've tried to have girlfriends come over to do like a yoni steaming circle. Like, and I'm still waiting for them to come and do that with me. But
And they won't.
well, I have like a couple of people who are interested, but you know, I'm always just like, let's step outside of the comfort zone a little bit.
Yeah, and there are practices that, once again, it's like cultural.
Yeah.
In some places, right?
Oh, absolutely.
And I'm culturally competent in the fact that if that's in your culture and that is something that you do, if you'll know your body, right? If you do it and it's something that makes you feel absolutely amazing, you feel connected to yourself, then go for it. However, if you do it and you're like, ooh, now I have, irritability, I have some BV and I don't know where it's stemming from, then that's not for you.
Well, I think always like doing your own research, making sure things resonate with you. Again, that's where I like to bring up then like making sure you're turned on or curious about it. Because like if your body shuts down when you hear something like that, then don't do it.
Yeah.
But if something were like, oh, I'm down to try that or something, then, follow the curiosity.
Yeah.
Cool. All right. So let's talk a little bit about pregnancy and postpartum and hormones. So what should women know about pelvic health before getting pregnant?
I just think that they should know what it is. What is your what is it? What's your pelvic floor? And that's the lead. Connect with your body. What's your pelvic floor? Because you're going to be growing a human. What is your pelvic floor doing during labor? Your pelvic floor has to move out of the way.
Yeah.
So
how can women prep their pelvic floor, prep their deep core, all of that for giving birth?
I would say if you're able to, stay active, continue to strength train if you're able to. There's so much research that's coming out about the importance and the benefit of strength training during pregnancy. Labor is a marathon and it's an experience between you and your child. So I think understanding what the pelvic floor muscles have to do during labor, advocating for yourself, different positions, hip openers, understanding that you don't have to give birth in one position. You're entitled to multiple ways, even with an epidural. So I think education and advocating for yourself is so important.
Do you think that it's beneficial for women to, because I know that there's some talk in terms of like hospital births and stuff, like they really encourage women to stay laid down. Do you have any thoughts about like different, like you just said it before, like some different positions for women to have like a more supportive or easier birth experience?
Yeah, and I support women with birth prep, ones that know that they know they want to go in epidural hospital, and ones that are trying for a VBAC home birth, and they just want to know, right? So I think that the best thing that you could do is move around. I didn't have much education during my pregnancies, which I wish I could do things differently, but I can't. I just think educating yourself and reaching, if you don't know where to start, reaching out to somebody that is educated, that's kind of where the key is.
Yeah. How long does it actually take for the pelvic floor to heal postpartum?
I think once you're postpartum, you're always postpartum.
Okay.
And then you're forever postpartum. And then you go into perimenopause and menopause. So, yeah, if there's issues postpartum, don't let them wait.
Linger, yeah.
Yeah, because then if you're the thought of like having another child and then having another child. So it's not going to get better if you just kind of let it hit the back burner.
How long should someone wait after giving birth before they start to strengthen and like rehab the pelvic floor?
In the hospital.
Or if you're, I was going to say, like, and if you're doing that while you're pregnant up to giving birth, and then after, like, also your chances of recovery are much quicker, right? Because you're already like strengthening that area.
You could connect back with your body in the hospital by breathing.
Mm-hmm.
So even like the 6 week all clear, like what are we all clearing? What do we, you're like for OBs, right?
Mm-hmm.
You're 6 weeks all cleared. Like what does that mean to them? That's from a medical perspective.
What does that mean? I don't even know.
Yeah.
Oh, like you're clear to have sex again? No.
Ultimately,
okay.
like during my 6 week like appointment, they were like, okay, 6 weeks all cleared. So you could have sex and you could, what birth control do you want? I'm like, what?
Oh, really?
Yeah. Yeah. I'm like, no birth control, first of all.
Yeah.
And maybe I don't want to have sex.
Yeah.
You know,
yeah.
like I would say what the doctors need to ask, like, what do you want to get back to doing?
Yeah.
Then
what are your goals?
We'll talk about it.
Yeah.
Or just automatically in a different country, like you're automatically given a pelvic floor evaluation.
Really?
Yeah, a script.
What countries, man? The U.S., we're so behind in so many ways.
I think it's
wild.
just sad.
Yeah. I just love this. Okay. How can working with the pelvic floor influence the way you show up in your life energetically?
I think just connecting to the most intimate part of your body.
Like, how could it not?
Yeah.
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 Shift the way that you show up as like a badass, beautiful goddess.
Exactly.
Yeah.
If you get confidence in a way, like if you could connect with your whole body and feel good about it, and it's work, right? Then you can, like, how do you not be confident in day to day?
Yeah. So would you say then, like, women walking around really like keeping their core, like trying to keep their abs like super hard, and like that's doing more harm than good?
Yeah, you don't always want to be like turned on tense wise. Maybe this goes back to like some feminine energy, like soft and,
Open.
like open.
Flowy.
Like we don't always need to be hard and turned on and suck in our bellies or hold our abs. Like free flowing.
All right, cool. What would a strong pelvic floor mean, quote unquote, beyond muscle strength?
Well, one thing that we kind of didn't touch on is, yes, we have to have a strong pelvic floor. Yes, it has to move and lengthen, but it also has to be coordinated with breath. So I think that you have, you look up information and it's like 2 tenths, 2 week, 2 tenths, 2 week. But a lot of it also stems from coordination. So we have to look at the breath, and that's like foundational. I'll always talk about breath and breath work and breathing and the importance of it, because that's going to coordinate with function.
Right. And also just nervous system health and everything else, that breath.
Yes, because our vagus nerve, that gets tapped into when we do like nice diaphragmatic breathing. We have some...
Yeah, I feel like this was actually all highlighted when I went to Bali and did my yoga certification. There was so much focus on the breath, right? Like just me as a student, and also like learning to become a teacher of the practice of yoga. And so it was just so interesting, learning more about that and learning the power of breath work, and just even like states of where you can reach through breath work, right? Just not even just like physically, just like, energetically. Well, I want to talk about some of the educational toys that you brought.
Yes. And I will always refer to them. They're therapeutic tools.
Therapeutic tools. That's such a better way so we don't get flagged anywhere. Therapeutic tools that you brought.
Therapeutic tools.
So show me what you got, sis.
Okay. So crazy that the clitoris just got mapped out from a nerve perspective.
Yeah.
In 2026.
Which is insane.
And the penis was like about 30 years ago.
Yeah.
So.
Mm-hmm.
So.
How many nerve endings are there? It's like 10,000?
Yeah, over 10,000. And you think of like, let's say penetrative sex where in order to, when we talk about sex and intimacy, a lot of people think about penetration and not clitoral stimulation, where a lot of women cannot achieve an orgasm through penetration alone.
Right.
It takes a lot, a lot more. So I'm like pro clitoral stimulation.
Yeah.
Yeah. So
bringing the therapeutic tools in the bedroom to just make it more fun.
Yes. And you could do it by yourself if you're okay with it. And you could do it with a partner if you're okay with it.
Wonderful.
But go for it.
So let me see what you got.
Yeah. So we have.
What is the material that those are made out of? I like
silicone.
the colors.
Yeah.
Silicone.
And they're nice and smooth. So these two.
It looks like a tongue.
Elixir play. So this is
Elixir play?
Yeah, for partner play. If you want, you could. This is a constrictive device.
Fun.
And then this is in the shape of a vulva, so it's vibrating as well. And this is all different kinds of shapes and sizes.
Yeah.
Go for it. Whatever in the world is your oyster.
Okay, I'm into it.
Yeah.
Do you think that what are your thoughts on toys leading to desensitization? Because I've heard some thoughts about that, just for anybody out there that maybe doesn't want to involve toys or thinks that there's like some type of stigma that like if I need toys additionally, my partner's not doing something right or.
Yeah, and that's a great question also. And I do have people that are like, I don't feel comfortable using them. I don't want to use them. And that's their choice.
Yeah.
And they don't have to. But also just bringing light to the benefit of ways that they can be used. Like they increase, like let's say if you don't or you can't achieve an orgasm. Being able to sensitize that space or bring blood flow, bring circulation, understanding sensation as a whole, like sex and intimacy is a sensory experience, and people perceive sensation very differently. Some people are overstimulated, understimulated. So knowing kind of what you need as a person, that's important.
Do you know anything about or are familiar with, I forget the full name. I want to say it might be the Breakthrough Blueprint. Jaya, do you know her work?
Wait, that sounds familiar.
She talks about different archetypes of sexual energy, and like there's some people who are kinky, sexual, sensual.
Yes.
It's almost like the love languages, but for sex.
Yes.
Yeah.
Yes.
So that's also interesting too. Like there are some people that environment, lighting, like it's not just an ego thing. Like you have to actually, the environment needs to turn you on and needs to allow for relaxation.
Yep.
For just like connection, for your body's ability to relax, just mentally.
Yep.
Some people like really are not turned on by the idea of toys. Some people need toys and all of that kind of,
Yeah. And I think it's important to understand what you like, especially if like you're in a long-term relationship with somebody people that are married for 30 years.
Yeah.
Things change throughout that course. So imagine being married and doing the same thing often.
You gotta mix it up a little.
And yeah, there was like somebody that said that people in long-term relationships need novelty at least once a month.
Yeah.
And from an experience of, I ask, let's say, couples or people, like, do you guys do the same thing? Are you?
Well, they have to prioritize.
Yeah.
So many people like don't prioritize their own sexual health. People just, especially if you're in a relationship, you have to prioritize like dating your partner, especially if you're in a long-term relationship, like keeping it fun. Your person is always changing, so making it a conscious effort to like get to know them again and again, what they like now versus what they liked then, and just kind of like always keeping a sense of newness in the dynamic to keep it interesting.
Yeah, because libidos change. Transitions, whatever you're going through.
Yeah, life transitions, right.
There's
all impact.
So many things that impact. And that's why communication is so important. Like, that's so key.
Yeah. Okay. Is there anything else that you want to add or that we didn't touch on? I know you brought some lube.
I brought lube. Lube, yes, because
I'm a coconut oil fan, and I know we talked about this when I first met you, or like one of the first events that we were at together. Just because, again, it goes from me the intention of just like there's so much product out there that is toxic.
100% agree. Yes.
You know, and like made with like not ingredients that you should be licking, putting in, anything, doing. So coconut oil is cool.
Yeah.
But you have this lube here that you like.
So I would say like whatever works for you is what you stick to, because what works for you may not work for me, right?
Yeah.
And everybody's individualized. So there are different types of lube. There's silicone, water-based, hybrid, oil, and try whatever works for you. But I think when I bring up like, do you use lube? They're like, oh no, I don't need lube. I don't want to use lube. And I'm like, well, what do you have against it? Or do you want to know a little bit more of the benefits of it? And it could be like really life-changing for people that have pain with sex. And a simple thing would be using some lube, because they're like, oh, I'm turned on. You know, I feel turned on. I feel like I'm wet. And it turns out that maybe incorporate it because you just need a little additional something
to like get it going. And then it's like, okay, then maybe there's like a surrender that can happen, or like a release. All right, cool. Anything else that you want to share or talk about? Perspectives on anything? I know that's like...
I feel like I know. I have so many in my
head.
I just think it's such a taboo topic that if people don't feel comfortable talking about pelvic floor health, vulvas, vaginas, penises, like reach out to somebody that is okay and being able to, let's say, advocate. Like if you're not okay with speaking to your doctor about something that you're experiencing, I have no problem reaching out to a provider saying like, hey, can we focus on, something that this client could do to make them have more pleasurable sex because it's painful, or to stop leaking, or let's prioritize their low libido or low desire. So
what could be a contributing factor to like low libido?
Hormones, and then also your mental state, just stress, anxiety. Oh, there's a bunch of things.
Yeah. Okay. All right,
and it shifts.
Yeah, and it changes all the time. All right, well, wonderful. Thank you so much. Do you have a discount code or anything that you want to drop, or with the products that you brought with us? Or
Elixir Play is amazing. And the owner of that company, she's female founded, and she had vaginismus. So she created these products based on women's anatomy, and they're very quiet. So I would say Elixir Play is so good. So check her out and check them out.
Awesome. And then for you, how can the people work with you, follow you, learn more about what it is that you offer?
So I work out of an energy healing studio in Bayside, Queens called 3 Elements Healing Arts Center. And I do one-on-one pelvic health and sexual health sessions. I do couples. I do fitness classes there. Personal, like one-on-one strength training classes there. So yeah, you can find me at Integrative Pelvic Wellness.
Awesome.
And I'll be there.
Wonderful. Yeah. All right. Well, thank you so much.
Thank you.
Really appreciate you being here, sharing in the energy, having fun, sharing your scientific approach to things. And hopefully we will have you back soon.
Thank you.
Yeah. For everyone else joining, listening, thank you so much. Please like, share, comment, and share this episode if it resonated with you or a friend. And we will see you next time on Juice is the New Tea. QG Flora is a luxury florist in New York with over 50 years of experience. They even provided us a special discount code you can use, the code CLEANBLOOM, for 10% off website orders over $125. So gift yourselves or your loved ones a beautiful arrangement. Juice is the New Tea is brought to you by Cleanse Juices. For more information on 3-day juice cleanses and 4 flavor packs, visit iamcleanse.com. Use code JUICEISTheNewT for 10% off all orders.